Mr. Kine.
Thank you, Mr. Chairman. Thanks for holding such an important hearing. I want to thank all of our witnesses for your testimony here today, and Ms. Keeping, especially your personal story about your son, Eli. There's nothing, I think, that moves policymakers more than actual people and the impact it's having on real lives back home. So we thank you for coming and sharing that. But this is a story that many of us hear almost every day when we're back home representing our respective districts. I mean, the rising cost of prescription drugs and what it means to individual health care and their access to quality health care so they can stay productive in our society. Now call me a little bit cynical, but all the years when our Republican friends were sitting in the majority, there was no H.R. 19. There was no consideration, no piece of legislation meant to drive down the cost of prescription medication for all Americans. Not until after we moved forward on H.R. 3 last year, which introduced price negotiation with the pharmaceutical industry to help bring those prices down. Now, Dr. Kesselheim, let me ask you about the importance of having that negotiating power and leverage with the drug companies that H.R. 3 provides with price negotiation. It was something that President Trump campaigned on in 2016, saying he wanted that authority. And he was going to negotiate like crazy with the drug companies to bring the price down. But now, for inexplicable reasons, he's backed off on supporting H.R. 3. And yet we know that in a free market, there's no more powerful dynamic between a willing seller and a willing buyer than the ability to discuss prices. In fact, the drug industry is the only industry the federal government does business with today where we are by law prohibited from discussing prices with. And that was because of the way the legislation was structured back in 2004 when the Part D plan was first formed. Dr. Kessel, how important do you think it is, even though H.R. 19 doesn't contain it, the Wyden bill in the Senate doesn't contain it, that we move forward with that negotiating leverage of price negotiation with the drug companies in an attempt to bring down the cost for our constituents, our consumers back home?
I mean, I think it's crucially important. Negotiating in this way is the most effective tool that we might be able to have to try to bring drug costs more in line with the value that the drugs provide. It's instructive, I think, as you mentioned, that Medicare negotiates or sets the prices for every other form of health care that it pays for. Radiology, x-rays, colonoscopies, hospital prices, except for prescription drugs. And it's also instructive that every other high-income country around the world negotiates prices with the manufacturers, and that's why we pay so much more than those other countries do for the very same drugs.
Let me ask you this. I mean, we've heard the arguments. Again, we heard it here today, that if we go down the road of price negotiation, it's going to ruin innovation, risk-taking, breakthrough drugs. It's going to hold all that back. And yet you said in your testimony, I think I got it right, I quote, that threat is not valid. Why don't you think that threat's valid?
Well, I think for a couple reasons. I would say, first of all, because a lot of the research that we've done shows that really important transformative innovation originates in government and publicly funded science that occurs in academic research settings and other nonprofit institutions. And so as long as we keep that line of funding available, then we will continue to make insights and have important new innovation that is really meaningful. And I think that so I think that that's one. I think that's one reason, and I think another reason. And again, those products then do get transferred into the private sector for further development, and that can cost a lot of money, and we should account for that. But as I said earlier, I think that assuming that if we lower drug prices, that all of that money will necessarily come right out of the innovation for the most important products is a false assumption. I think that there are a lot of brand name drugs out there that drug companies are selling for very high prices that don't offer a lot of real important clinical benefit to patients, and doing better negotiating prices so that they are more in line with the value that they provide will perhaps provide actually more incentive for the innovation that we need.
My time's expiring, but last night we had the State of the Union address, and sometimes it's the dog that doesn't bark that should receive more attention. And last night, while the President called for a bill that would lower the cost of prescription drugs, that he'll sign on it, he didn't offer any specifics or any leadership on this issue. In fact, the only two health care proposals he talked about was their promotion of the so-called junk insurance plans that they're offering so people can literally pay to be underinsured, and also price transparency with hospitals. Would either one of those proposals have any impact on prescription drug prices that our consumers are facing?
No, they wouldn't.
Okay, thank you. I yield back, Mr. Chairman.
Thank you very much, Mr. Smith. Thank you, Mr. Chair.